எதுவும் இன்வைட்லாம் எனக்கு எதுவுமே வந்து சேரல, அதனாலதான் கேக்குறேன்.
சார் சென்ட் பண்ணியிருந்தேனே சார். சார்
ஆக்சுவலா வந்து 2 டீம் சார், டீம் 1 டீம் 2 இருக்காங்க. ஒருத்தவங்க வந்து கவர்மெண்ட் பாலிசி. நிதிஷ் எக்ஸ்பிளைன் பண்றியா?
இல்ல, அது ஐ நோ தி டாபிக். I just want to know how many of them on each side.
Sir,
8 members total இருக்காங்க சார்.
Whether this is get price அந்த மாதிரி எல்லாம் கொடுக்குமா இல்ல just a debate?
Just a debate. As for now, it's just a debate. நீங்க ஏதாவது price announce பண்ணலாம். We are well and good to receive it, sir.
Okay. ஓகேங்க.
Yes, sir.
Nitish, you are on live.
Okay, bro. Kavya, you can start.
Good evening, everyone. I warmly welcome you all to today's online debate program conducted in observance of National Tuberculosis Day 2026. I'm Kavya, member of the Cultural Subcommittee, and I will be a host for today's event. We are glad to have our respected judges, participants, and audience with us for this meaningful academic discussion. Now, to begin the program, I request Mr. Nitish Stephen, Head of Cultural Subcommittee, to deliver the welcome address. Over to you, Mr. Nitish.
So, good evening, everyone. I'm Nitish Stephen, Cultural Subcommittee Head, Day 2026. Tuberculosis continues to be a major global health challenge, and this year's theme reminds us of the importance of collective effort in eliminating this disease. So, with that in mind, we gather here to discuss a thought-provoking topic, which is what matters more in ending tuberculosis, government policies or public participation. So, at the outset, I would like to extend my heartfelt gratitude to our esteemed patrons for their constant support and guidance. Dr. B. Sridhar sir, Dr. P. Sengotuan sir, Dr. A. K. Ravikumar sir, Dr. N. R. Tyagarajan sir, Dr. M. Diravya Mohan sir, and Dr. D. Solomon Jaya sir. Your leadership and encouragement continue to inspire us all, sir. I would also like to sincerely thank our dedicated state team, Dr. R. Annamalai sir, Dr. S. Jamuna Rani ma'am, and Dr. V. S. Hariharan sir, and Dr. Kannan Rajendran sir for the invaluable effort in shaping this initiative. A special note of appreciation goes to our dynamic coordinators and office bearers, Aranyagiri ji, Ajay Karthike, Bala Hariharan S, and Hariram Vijay for their commitment and teamwork in making this event possible. We are honored to have with us our esteemed judges, Dr. Hariharan sir and Dr. Kannan sir, whose expertise and insights will guide today's event. We also warmly welcome our 8 enthusiastic participants who will be debating in 2 teams of 4, bringing forward diverse perspectives on this crucial issue. Let us make this session engaging, respectful, and enlightening. I wish all the participants very best. Thank you.
Thank you, Mr. Nitish Stephen. It is my privilege to introduce our respected judge for today, Dr. Hariharan sir. Dr. Hariharan sir is a consultant in internal medical and diabetology at Glen's Hospital and Chennai with more than 12 years of clinical experience. He holds an MBBS degree and has completed MRCP from the UK. His expertise includes management of internal medicine condition and diabetic care. He is known for his patient-centered approach and dedicated to quality healthcare. We are very happy to have you with us, sir, today. Welcome, sir. Next, I would like to introduce our second respected judge, Dr. Kannan, sir. Dr. Kannan, sir, is an alumnus of JIPMER and has many years of experience in clinical practice and teaching. He previously worked on consultant at Apollo Hospitals, Chennai, and is currently professor in Department of Surgery at Mahatma Gandhi Medical College and Research Institute. His areas of expertise include laparoscopy surgery, endoscopy surgery, diabetic foot care, and medical education. He has guided many undergraduate and postgraduate students and is well known for his dedicated to teaching. We are truly honored to have you with us today, sir. Welcome, sir. Rules will be explained by Sanjana. Over to you, Sanjana.
So, good evening to one and all present over here. Before we commence the debate, I'd like to give a brief about the rules of the event. So, number 1, team composition. There will be 2 teams, one supporting and one opposing the motion. Each team will consist of 4 participants. The second rule, time allotment. Each participant will only be given 3 minutes to present their views. And a gentle reminder will be given at 2 minutes. Participants are requested to conclude within 3 minutes maximum. Third, the flow of the debate. The supporting team will begin, followed by the opposing team. Each participant will speak individually. No interruptions or questions are allowed during the speech. After each speaker, there will be time allocated for the questions. Number 4, question time, cross questioning. After each speaker finishes, the opposite team may ask one cross question and the speaker may respond briefly for clarification. Questions should be respectful, relevant, and concise. Fifth, the judges round. After all participants have spoken, the judge or the moderator will ask 4 common questions to both the teams. Each team must defend their stance logically and clearly. Sixth, authenticity and responsibility. All the information presented must be accurate, evidence-based, and from reliable sources. As this is a sensitive/gray topic, the debate will be recorded, edited, and posted rather than being live streamed. Participants must avoid controversial, unverified, non-evidence-based statements. This is to keep the discussion educational, balanced, and seventh, general etiquette. This is an informative academic discussion, not merely a competition. Maintain mutual respect and professionalism at all times. So do not interrupt other speakers while they're speaking. Ensure stable internet connection and clear audio. Follow the moderator's instructions for smooth conduction of the session. Thank you.
Now I request our respected judges to explain about the event and today's debate topic. Thank you.
Hari sir, please go ahead, sir. I'll join you.
Thank you, guys. I think you made me a lot younger by saying 12 years of experience. So thank you for that as well. So I think World TB Day is coming, and it is a disease that is there in nook and corner of our society, and there's a lot of stigma attached to it, and that makes it more difficult to identify, complete treatment, and then probably eliminate NTB. That's the goal of whole celebration of World TB Day. So I think it's good that MSN has come up with a good debate. Let us hear from you, and from then I think we'll have our comments towards the end. Thank you.
Thank you so much, sir.
Hello. Sorry, I'm not able to switch on my video due to some technical issues. But,
Okay.
TB Day has always been the most important thing for which it's not about celebrating, it's not remembering what is this tuberculosis all about. Yes, debate is one of the most important ways where we express ourselves. The way we express ourselves is where we are talking in favor or where we're taking it against it. But then the topic, as people were saying, it's a very important topic. And please understand, tuberculosis is something which is very, very near and dear to every specialty, whether it has to be medical specialty, a surgical discipline, or when it has to be pediatrics or super specialty. The tuberculosis is always after us. And I'm sorry, as budding medicos in and this particular generation, I think it's a very, very important topic, and it's a very, very innovative way which our medical students network has been doing it. MSN and JDN, both of them has been growing hand in hand, and they have been doing amazingly. I'm a new entrant to your team, and I forcibly walked my way through into your team because I was very impressed with the way it has been happening. And I keep telling Hari sir or Jamuna ma'am, every time, whenever I'm part of an IMA, I keep asking them what's going on. And thanks to Hari sir, I've also been a part of MSN for quite some various activities. And and the team and the high structure, how it is happening, it's very foolproof and it's quite good the way it is happening. So me being a Pondicherry, me staying in Pondicherry, I understand that the MSN structure has to be strengthened in the Union Territory of Pondicherry. I wish and I hope our Tamil Nadu team can help the Pondicherry team to grow. So I think with these few words, I think you guys, it's your day. So keep rocking. We are there. We are here to learn what good things and evidence-based medicine you're going to tell us. Thank you, guys. Hello.
Now, may we move on
Yeah,
to the debate session? Okay. Now we move on to the debate session. We begin with government policy side. And speakers, can you please introduce yourself?
Good evening, sir. This is Rishika, final year MBBS student of Sri Sathya Sai Medical College, Chennai.
Good evening, everyone. This is Sai Shakti from Madhav Medical College.
Good evening, everyone. I'm Karnika from Amrita Institute of Medical Sciences, Kochi.
Good evening, everyone. This is Keertan from Tagore Medical College, second year.
Good evening, everyone. I'm Sahana from Sri Sathya Sai Medical College.
Good evening, everyone. This is Lalita M from Nilima Institute of Medical Sciences, Hyderabad, pre-final year.
A very great evening, everyone. I'm Pandam Meenashri from Thoothukudi Medical College.
Hello, good evening, everyone. This is Agar Dewari from MJ Medical, a pre-final year student. Thank you.
So now we can proceed with the actual debate, starting from the government policy side, Rishika.
Respected patrons of IMA-MSN PNSP, esteemed state leaders, respected judges, member of the organizing committee, and my fellow participants. I am Rishika, final year MBBS student of Sri Sathya Sai Medical College and Research Institute. On this World Tuberculosis Awareness Day, we are not just debating a public issue. We are debating about the elimination of one of the India's most enduring public health challenges worldwide. India accounts for nearly 27% of global TB burden, with over 10 million cases worldwide each year, and around 1.3 million deaths annually. In 2023, over 24 lakh TB cases were notified in India under the program National Tuberculosis Elimination Program. Can a disease of this magnitude be eliminated by public participation alone? Definitely no. I firmly stand in support of the motion that government policies matter more in ending tuberculosis. As the affirmative, public participation is a supporting actor, while government policies is the director. We do not argue that the public participation is irrelevant. We argue that the legislative framework can be done only by the state provides. In the debate where my friends are defending government policies, molecular diagnostics are the star witnesses. They prove that the modern medicine requires high-tech infrastructure and only government policies can be provided into it. Molecular diagnostics provides high end-to-end medical assistance that looks for genetic material of the organism, unlike microscopy. The FAN provides this at free of cost. It proves that ending TB is a systemic, state-led mission that the public cannot replicate on its own. Under the National TB Elimination Program, NTEP, the Indian government has established one of the world's most extensive free diagnostic network. As of 2026, the government has pivoted from old-fashioned microscopy to molecular first testing. Firstly, CBNet, Gene Expert. It uses technology called RT-PCR, real-time polymerase chain reaction, available at free of cost in almost every district in TB centers. It detects both tuberculosis and rifampicin resistance in just 2 hours. TrueNet, a portable revolution developed in India, it is a battery-operated deployed over 6,000 community centers and primary healthcare centers. Government used TrueNet to reach the miles ago in rural villages where electricity is not steady. Line probe assay, advanced genetic testing provides for free. Another fascinating diagnostic features was established on 9th March 2026. World Health Organization announced a new recommendation test for tuberculosis. They, this test uses tongue swabs instead of sputum. This is a game changer because many people, especially children, struggle to produce sputum. And what's fascinating about this is it gives the result with just 25 minutes. Now, coming to the financial policies. Nikshay Poshan Yojana. This policy provides thousands per month directly to the patient's bank account for nutrition. The government provides latest drug regimen uh, to the patient at free of cost. The reason India's TB incidence is dropping because of the National TB Elimination Program infrastructure. The government has taken the burden of cost from molecular tests to monthly nutrition and made it zero of cost for the citizens. It is not public participation. It is merely a state-led resource machine. If public participation alone could have eliminated TB, India would have eliminated TB a decade ago. Policy determines infrastructure, financing, uh, surveillance, and accountability, ultimately ensuring the care in delivery. Let me frame it clinically. Public participation is a supportive therapy. It is important but insufficient without definitive management. Government policy is a definitive treatment. Without government, participation becomes fragmented. Without regulation, drug resistance escalates. Without surveillance, elimination becomes aspirational rather than achievable. Tuberculosis elimination is not just merely an emotional campaign. It is a measurable, policy-driven public health strategy requiring sustained political commitment. Participation supports the mission, but policy defines the mission. I would like to put forward a small question to my opponent team members. Since they emphasize on public participation matters, I'll be happy if they explain how public participation provides a $20,000 gene expert mission to a rural villages without the government policy support. Therefore, I conclude by saying public participation provides the will, but government policies pave the way. I'm grateful for the opportunity. Thank you all.
Thank you, Ms. Rishika. Any cross questions?
Yes. I have one cross question. Can I ask?
Yes, sir.
Okay, so
Go
you have
ahead.
specified yes.
Go ahead, Keaton.
Yes, sir. You have specified all the advancements like gene expert and other things. So, what are the actual like prevalence ratio? Has it decreased, or what are the results from it? Because even I don't know as a medical student, how do you expect the public to know about this advanced tests?
That's why saying public policy, it is the baseline where they'll be giving the treatment or the advances to the public participation. Like without the government policies or underlying government support, they cannot reduce TB-like sustained infectious disease. Is was the point where I come to see.
Okay, thank you.
Welcome.
Up next, I would like to welcome Sai Shakti to speak.
Good evening, everyone. Hope I'm audible.
Yeah, you're audible.
Thank you, sir. So, good evening, respected leaders and my fellow participants. I'm Sai Shakti from final year, and I'm here to speak in favor that yes, government policies play a major role and it matters when it comes to ending a disease such as tuberculosis. So, with that said, I would like to start with a very simple question, and that is for a country like India, which has witnessed numerous diseases and numerous pandemics, be it smallpox or polio, poliomyelitis, or be it COVID 19. We've come through a lot of diseases, and India has tackled almost everything with the help of its healthcare system and government policies in the best way possible. So my question to you is very simple. Do you think that we stopped in case of control of polio with just our national immunization schedule? No. What did the government do? It brought in the polio. And now that you know was a game changer when it came to the control of poliomyelitis. Moving on to COVID-19, we did not just stop with giving awareness about just facial masks, or we did not just stop with protective equipments, but instead, what did we do? The government brought in lockdowns, and those lockdowns was not a chance. It was not a choice, but instead, it was a mandatory rule which was brought by the government. And what did that lead to? It led to the end of COVID-19. That's exactly what I'm trying to leave here. That's a question that I want you to keep wondering before I end my argument. Tackling all of these diseases with the best of government and the healthcare systems, why are we even debating about if it's public participation or in policies? Next, moving on to my argument, tuberculosis is not just merely a disease that you can easily control. It's a very challenging disease, be it from the prompt diagnosis or to the duration of treatment or to the complications that it comes with. But you must remember that tuberculosis is not something that we could easily tackle with. If so, then why are we worrying about it so much that we are actually debating about? That's exactly what I'm trying to tell you. When it comes to TB, you cannot just simply end it with public participation. Instead, when it comes to TB, you require strict government policies such as DOTS. And that what is that? And that is directly observed treatment short course. When I told you about the challenges that become with treatment of TB, it was poor compliance due to long duration. And what did the government do to actually tackle that? It brought in DOTS. And now you know, and we have studied in community medicine, that DOTS was a game changer and it was a milestone achieved when it came to the control of tuberculosis. Moving on to the next argument, I would like to say that tuberculosis is not like any other non-communicable disease. For example, when it comes to diabetes mellitus, or when it comes to hypertension, or when it comes to cervical cancer, we can hold numerous public awareness campaigns about the risk factors or the lifestyle choices. But what do you think can you do when it comes to a disease like tuberculosis? Because do you really think any patient that PD has the knowledge about how they got it or the symptoms they're going to present with? No, that's exactly what I'm trying to tell you. When it comes to a deadly communicable disease such as tuberculosis, you require the effort of the government because it's not simply a disease that you can just stop with public awareness. Moving on, the next point of argument would be the right to information and the level of public awareness. Coming to a country like India, where take in case of COVID-19, it took us months to convince people that face masks actually prevent COVID. And it took us other couple of months to actually prove that, to actually enforce that habit into their lives. And that's exactly what I'm trying to tell you. Because one second you are out there trying to create public awareness, and the other side you watch a reel where they tell you about how you can cure tuberculosis with home remedies. And maybe you watched a video yesterday in YouTube about how there are like a lot of wrong things which are being easily propagated. That's exactly what I'm coming to. Coming to the levels of public awareness in India, it's extremely low. And you cannot take a risk with a disease such as tuberculosis. So, right to information, right source of information, and proper public awareness can be only mediated by strict government policies. Now, when it comes to the right source of information, any person who is affected with tuberculosis has the right to know how they got it, how they're going to spread it to others, how they'll get cured, or their plan of treatment, and every single thing. And that should be mediated by the right source. And for that, the government policies and our healthcare system must work hand in hand. Moving on to the next thing is my last question that I would like to leave you pondering with. For a disease like tuberculosis, which causes one death every 3 minutes, are you going to convince me by saying that public participation is just going to be enough? Or are you going to get convinced that government policies is the only way that you can actually stop the burden of this disease? So keep thinking and come to me and tell me that our healthcare system, along with the government policies, is the only way by which you can actually stop deaths and the burden of this disease. With that, I would like to sign off. Thank you.
Wow, Sai Shakti, it was a great speech from you. Is there any cross questions from the audience?
So yeah, there is a cross question from my side. My opponent has emphasized on DOTS therapy, right? So first, what does DOTS stands for? Directly observed treatment. So if a patient is not willing to take the treatment regularly, how does system succeed without their participation? Like even when you expanded the DOTS itself actually answers your questions there.
Yes, yes, Lalita, that's a good question. But actually, what I'm trying to prove here is that any disease, be, with extremely poor patient complaints, there is no way you can eradicate it or go closer to eliminate it. But the government actually making a choice to directly observe you and to push you into taking your treatment is what it can do. And that is, I think, a progressive way to get somewhere closer to ending tuberculosis.
It was a nice answer from you.
Great answer. That's a great answer, Shakti. So I would like to call upon Lalita to speak behalf of public participation. Over to you, Lalita.
Tuberculosis Day. I would like to begin by acknowledging my opponent's policies are essential. But the real question here is not whether policies exist, it is whether are they successful. Because if policies alone could eliminate tuberculosis, India, as my opponent said, with one of the most comprehensive TB programs in the world, should have achieved the goal now. But we haven't. Tuberculosis continues to claim over 1.3 million lives every year globally, and India contributes 27% of the burden. And this persistence is not due to lack of policy, but due to the gap between policy and the people. According to WHO Global Tuberculosis Report, a significant proportion of TB cases remain undiagnosed or unreported, not because of services are unavailable, but people do not seek care in time. Similarly, drug resistant TB continues to rise, not because medicines are ineffective, because the treatments are not completed. So, this is not a failure of a policy design, this is a failure at the level of behavior. Because tuberculosis is not just a biomedical disease, it is a behavioral epidemic driven by delay, denial, and default. A patient who delays testing due to stigma, a worker who stops treatment once symptoms improve, and a family that hides the disease instead of supporting recovery. No policy can monitor that. No policy can correct that. No policy can cure that. Only people can. In fact, even the WHO End TB strategy identifies community engagement as a core pillar, not optional but essential. Policies may ensure access, but only people ensure acceptance and adherence. And that is where the real battle is won. And as an aspiring doctor, this perspective is what shapes my understanding of healthcare. That the success of any treatment does not lie in what we prescribe, but in what patient actually practices. Because a prescription, however perfect, has no value if it is not followed. And tuberculosis reminds us this every single day. So, in tuberculosis control, the real question is, do we have policies, or the policy successful? It is, do people follow them? We do not have a policy deficit in TB control today. We have a participation deficit. Policies may initiate the fight, but people finish it. And that is why public participation plays a greater role. Thank you.
Then I would like to call Ms. Karnika to speak behalf of the team, government policies team.
Am I audible?
Karnika, yeah, you're audible, Karnika.
So, good evening, ladies and gentlemen. I am Karnika, a second year student from Amrita Institute of Medical Sciences, Kochi. And today I stand firmly on the side that government policies matter more in ending tuberculosis. Tuberculosis is not just a disease of an individual, it is a disease of the society. It spreads through air, silently affecting millions. And when a problem affects an entire nation, the solution cannot depend only on individuals. It needs strong government action. First, let's talk about reach. Can individuals go door to door and test millions of people? No, but governments can. Through national programs, free testing camps, and vaccination drives, they reach even the most remote villages. Without this large scale effort, TB would continue to spread unnoticed. Second, treatment. TB treatment is long and expensive. Many patients come from poor backgrounds. If treatment is not free, they will stop halfway. And when that happens, TB becomes even more dangerous, drug resistant, and harder to cure. Government policies ensure free medicine, free diagnosis, and continuous care. This is not just help, it is life saving. Third, infrastructure. Awareness alone cannot cure a disease. You need hospitals, labs, doctors, and technicians. Who builds these? The government. Without proper healthcare system, even the most aware citizen has nowhere to go. Fourth, data and control. To fight TB, we must know where it exists. Governments track cases, identifies hotspots, and act quickly. Individuals cannot manage such data on a national level. As we say, you cannot fight what you cannot see. And most importantly, root causes. TB is strongly linked to poverty, malnutrition, and poor living conditions. Can individuals fix poverty alone? No. But governments can introduce nutrition schemes, improve housing, and provide financial support. They don't just treat TB, they prevent it. Now, the opposite side may say public participation is important. Yes, it is important. But let me ask, how will people participate without access? How will they act without support? How will they get treatment without access? And how will they participate without awareness? Public participation works within the system created by government policies. Without the system, participation becomes powerless. So let's be clear, people play a role, but governments create the impact. To conclude, ending tuberculosis is not just about individual effort, it is about organized, large scale, and sustained action, something only strong government policies can provide. Because when government acts, millions are protected. Thank you.
Thank you so much, Karnika. Is there any cross questions for government policies from the public policy team?
Yes, sir. We have one question.
Yeah, go ahead.
Karnika, you have mentioned like your side very well and it was impressive. And you have also mentioned government policies are more powerful than the public participation. You have said that thing. Now I have one question for you. That is, if policies are enough, are you suggesting human behavior has no role in disease cure or disease spread?
That is a really nice question. So yes, human behavior does have an important role, but how are we going to organize it? How are we going to like have a view on it? Like for example, if we take the Ebola virus, a lot of people were actively participate. I mean, they didn't want to participate, and because of that, what happened? It just didn't they started hiding the people. They did not believe in the government, and that just led to various other problems. That is one extreme of the spectrum. And then if we take tuberculosis itself, there is a high chance for it to become a drug resistant variant of this tuberculosis. Why? Because of over participation. What if they just go to the pharmacy and ask for an over counter medicine and they just consume it? What is the as far as if there is no if there aren't any government policies, then there won't be any proper control over the behavior of the people. And yes, behavior of the people is necessary, but then there should be some control. There should be some policy which monitors this control. And that is the reason as to why I believe that government policies are a lot more, they matter much more than public participation.
Okay, but now from your answer, I have got a question that is, if patient stops treatment midway, which is the main cause of drug-resistant TB, as you have mentioned, is that a policy failure or a people failure? If the patient is getting a drug-resistant TB due to his stoppage of taking drug, now whether it will fall into a policy like that is a people failure or a policy failure. So who has the more impact on it? Public participation or government policies?
Yes. So if we consider that, and if we imagine that we reduce all the government policies at all, then how are we gonna how are we gonna treat this disease? If we remove all the government policies, absolutely nothing, and we take this one scenario wherein there has been which has proved that if public participation goes wrong, then it could lead to problems. The one solution that is a little higher than a public participation is going to be government policies. That is the only viable solution that we have right now. So if that is the solution to a problem, then shouldn't it be of much more importance?
Have said one thing, like if government policies and I got your question now. I have another question. Like we have one thing we clearly studied in community medicine, that is primordial prevention, that completely in public participation only. So even without the involvement of the government or without the involvement of the government policies, we can prevent one disease that comes under primordial prevention. So a government policy without public participation cannot cure one thing or cannot stop one thing. Government policy can initiate that, but only public participation can finish that thing. So I think you got it what I said. Thank you. That's all from my side.
Thank you so much, team, for a great cross questions and taking over things. And I would like to welcome Kirtan from the public policy team. Over to you, Kirtan.
Thank you so much, sir. So, good evening to honorable dignitaries, worthy opponents, and members of the audience. I'm going to be speaking about the importance of community participation in tuberculosis treatment. And I want to start with a small quote by Dr. Paul Farmer. So, he's a physician who pioneered treatment strategies for TB and HIV. So, his quote is, with rare exceptions, all of your most important achievements on this planet will come from working with others, or in a word, partnership. So, let us make our stance clear. Government policy is the engine of healthcare, but public participation is the fuel, and an engine without fuel is just a heavy piece of metal going nowhere. Then, some studies. A scoping review by Leslie and Caesar analyzed 130 studies globally and concluded that TB is a social disease. And it has also found that community participation actively identifies and removes local barriers that government policies completely overlook. In another study by Arshad et al., it was reported that community-based interventions increase the probability of TB case detection and the success rates of treatment. These studies emphasize the importance of public participation more than the government-led plans. Then, Rishika had mentioned about molecular diagnostics like Gene Expert, but even if it's free of cost, if people don't go for it, then what is the use of it? It will just lay empty in a warehouse and it will get wasted. Then, government healthcare systems are often just passive. They wait for the patients to seek help. But public participation is active. It is the teacher who notices a coughing student. It is the neighbor who pushes a friend to get tested. And a study by Grace and PubMed proves that 70% of patients dismiss their early symptoms as a simple cold. The government cannot find that. They do not walk into those hospitals until they are coughing up blood. Then, another thing told by Sai Shakti ma'am, how much ever the government policies put, it's impossible to find these cases. And government cannot push us. Only our community members and our family members can push us to get these cases. Like I mentioned, the teacher can only notice the coughing student. Then, the government does fund scientific research for new TB drugs and vaccine. But even the most miraculous vaccine is useless without public trust. Look at vaccine hesitancy. A massive cross-sectional study by Rupali ma'am across Brazil, Ghana, Kenya, and Pakistan, only 19% indicated they would definitely intend to receive a TB vaccine, ranking the absolute lowest compared to other vaccines. Furthermore, nearly 40% of respondents felt vaccines were unnatural. When nearly 40% of a vulnerable demographic believes that government vaccines are unnatural, top-down government policies just fail. You cannot mandate trust. It can be built only through public participation. Furthermore, clinical trials that the government should do for discovering the vaccine require people. So, without community participation, the vaccines can't even be made. Then, Karnika ma'am had mentioned that the last mail, it's a really long treatment, and last mail is when, last mail there she had mentioned, and then Nikshay Poshan Yojana. This is a failure of NTEP. Then, TB also spreads in crowded, poorly ventilated environments. While governments can draft long term housing policies, daily preventions like cough etiquette, ventilation, and social distancing relies entirely on immediate public participation. Then there's one main failure of National Tuberculosis Elimination Program. It is the failure to overcome social stigma among women who hide their symptoms due to fear of reduction. And as patients drop out due to this last mile treatment, passive government system just lead to high rates of MDR TB and it becomes even more worse to treat. So, to conclude, surviving TB is just grueling and isolating. While government political priorities shift and budgets get reduced for TB, the emotional resilience and continuous care required to keep a patient fighting can only come from a community. $1 billion worth of medicine sitting in a government warehouse cures absolutely nobody. It is the public that ultimately cures the disease. For these reasons, we strongly urge that public participation is more important than government-led plans. Signing off, this is Kirtan from Tagore Medical College.
Good one, Kirtan. Now, any cross questions against Kirtan? So if not, we'll proceed with Kushagra from public participation.
Okay, so am I audible?
Yeah, you're audible.
Okay, so good evening, very good evening to everyone, respective judges, worthy opponents, and my dear audience. My opponents have strongly emphasized government policies as the backbone of tuberculosis elimination. I acknowledge their importance, but they have overlooked one crucial truth. Policies do not work in isolation. Policies fail without people. Even as we as undergraduates, so only understand a fraction of these policies. We don't know a bunch of it. So what about the general public, the non-medical population? If they are all unaware, uninvolved, or unwilling, even the best policies remain only on the paper. Tuberculosis is not a disease that can eliminate by orders or regulations alone. It demands strong public participation at the grassroots level, and especially a disease like tuberculosis, one of the deadliest threats to humankind. Take the last mile problem of treatment. Tuberculosis treatment is a brutal one. It takes 6 to 9 months of having medication. So you can't force government to provide that they put the medicine into each and every person. So family members and community health workers, they are the one who would be adhering to the medication. Another major barrier is the stigma. TB patients often hide their illness due to the fear of social judgment. Let me ask, can any policy will remove stigma? No, only societal change, education, and public awareness can break this silence. So, as told by Sai Shakti about the COVID-19 example, so I would take it as like that. COVID-19 was like a tsunami, and it came, it surged, and it receded. It was not like a continuous problem. So, but tuberculosis is like a tidal effect. It's always there in the society. It will surge up and down. It's we as a public who will have to cure it. We cannot completely stop the bacteria from entering our body, but we can prevent its progression through nutrition, awareness, and early detection. And it will happen only because through public participation. So government, they are providing infrastructure funding programs like NTEP and all this thing. But let's be honest, who use this facility? It is actually the public who will be using it. Without public involvement, large-scale reach becomes large-scale inefficiency. Free treatment is only useful if people accept it. As told by Rishika, the public, how would they get machine? Public, like, how would they get machines for diagnosing things? But hospital labs do not find TB. People are the one who will be coming forward and get tested. As one point raised by Rishika also, that we have shown like polio. Polio is the biggest policy that have achieved in India actually. But if that has to be true without any public participation, then what is the case of other countries, like especially in Pakistan? If policies would be agile enough, then we are not getting the polio vaccination till now as well, just because of still prevalent polio and other thing in Pakistan, Afghanistan. So early detection, which is the key to better prognosis, happens only when people are aware and proactive. So if policies were all enough, tuberculosis would have been eliminated long ago, but it still exists. Why? Because implementations happens at the level of people. So policies, they can only provide the framework. The real driving force is the public. It is not only a medical problem, it is a societal disease, and only a societal participation can eliminate it. Thank you.
Good one, Kushagra. It was on point. So, any questions against Kushagra?
Yes, please. I just have one question.
Yeah, you can proceed.
Shadra, that was a great way to put out your thoughts, but I just have one question, and that is you had brought down the COVID-19 as a tsunami which came, that existed, and that left. But the came that existed and left last for 2 years, taking away so many lives. But the only way we dealt with it in the most effective way was strict lockdowns, which is brought by the government. So, do you really think that COVID-19 would have gone away on its own and not stayed like tuberculosis if we had not brought down those government policies? What I'm trying to ask here is, do you really think that if we had not brought, I think that if we had not brought the government policies, then COVID would have just been another TB staying here, living among us, just like that, killing so many people on its own?
Okay, very nice question, Sai Shakti ma'am. Actually, yes, it existed for 4 years, but we all know that TB is not since 4 years. It was always there and will be there. We are developing every new strain of tuberculosis every day. We do get COVID vaccination. That's all over. We don't know that in future we'll get COVID or not, but we know that TB is still there. Government, like you talked about lockdowns, right? So lockdown was on like an urban scale. I know the situation of rural scale. I know what happens at the ground. Even I was out of my home when there was lockdown in my local village. So you can't say that government policies are being implied at all the levels. At the basic level, it is the people, it's the public that do so. So still, I believe that COVID was eliminated, or we can say that it was controlled due to public participation itself.
That's right, Kushagra. But the doubt I have in that part is when you spoke about government policies failing to be implemented at various levels of the society, then do you really think that public participation would be effective at every level of the society, being it from the rural people who are not completely educated or aware about every consequence of tuberculosis?
I won't say government policies exactly fail, but they can't be able to reach that level, right? Public participation is like more a stronger part compared to government policy, right? And it is better for NGOs to, like, I see I am also part of an NGO like NEMAT, National Youth Movement Against Tuberculosis. So that is working at the basic level and not the government actually.
That's acceptable that you're saying that it's not failing at the but all that I'm trying to tell you is when it comes to failing at the rural level, it's both of it. If you're going to put it only on government policies, then public participation is not going to fully educate every person in the rural area about the consequences of TB. That requires both government policies and its strict enforcement. That's all that I'm trying to tell you.
Okay, but it's better for NGO, right? Non-government.
It's completely understandable. Thank you, Kishore.
Sure, thank you. Now we would proceed upon Sahana from the government policies team.
Good afternoon, everyone. So I'll start. Tuberculosis is not just a failure of awareness, it is a failure of system. Yes, and systems are not built by the public. In 2023 alone, 10.6 million people developed tuberculosis and 1.3 million people died from it globally. India carries the heaviest burden, approximately 27 of global TB cases, making it the epicenter of this epidemic. Now, understand this. This is not a local problem. This is not a behavioral problem. This is national scale biomedical crisis. And national scale crises are not solved by participation. They are solved by policy power. Let's talk outcomes, not just opinions. Since strengthening its national response under the National Tuberculosis Elimination Program, India has achieved a 21% decline in TB incidents for 2015 to 2023. Over 2.5 million TB cases notifications in 2023 alone. Expansion of rapid molecular diagnostics. National-wide implementation of Nikshay Poshan Yojana. These are not outcomes of awareness. These are outcomes of structured, funded, enforced government policy. Now let's dismantle the illusion of participation leads to change. Global, only 70 to 75% of TB cases are detected and reported. That missing 22 to 25%, they're not hidden because policy failed to exist. These are hidden because policy has not yet reached them effectively, which means the solution is not more participation. The solution is stronger, deeper, more aggressive policy penetration. And here is the argument they cannot escape. The WHO's drop strategy, a government led policy driven treatment model, has saved over 70 million lives since 2000. 70 million. That is not just participation, that is policy at scale overriding even more clinical. Tuberculosis control depends on three non negotiables: early and accurate diagnosis, uninterrupted multi drug therapy, national surveillance, and reporting systems. None of these are created by public will. They require laboratory infrastructure, pharmaceutical procurement system, regulatory policy. So when the opposition says public participation matters more, what they're really saying is support systems matter more than the system itself. And that is not just wrong, it is structurally impossible. Tuberculosis does not disappear because people care. It disappears when government built systems are powerful, then even it cannot sustain it. Because in the end, participation may support the fight, but policy is the only reason the fight is being won at all. Thank you so much.
Thank you, Sahana. It was brilliant. So, any questions for Sahana?
You have well said about government policies, but policies, as you told, that are designed at national level, but TB spreads at individual level. How do you bridge that gap without people's involvement?
Okay, I'll ask you a simple question. If it all of you, all of the opposition has claimed that tuberculosis is fundamentally a behavioral problem. So what was happening before all of these TB policies existed? Why was the mortality rate in millions? You claim that it is a fundamentally, all of you, every one of you have claimed that it is a fundamentally behavioral problem. So why is it disappearing when the policies are getting stricter and stricter? It is reaching everyone in some or the other way. Even if people are not sticking to the regimes, people are not sticking to the medication, it is somehow reaching every single person. And that is why like I mentioned already, the instances have reduced by 7 million, and that is a WHO census. So how is that happening?
So yeah, yes, the TB cases have declined, but that reflects not just policies, but improved participation. If policies alone were enough, TB would have been eliminated by now, not just reduced. In fact, it is all increased. I've seen the data, and a decline curve does not prove policy dominance. It proves that when people participate, policies begin to work.
I'll tell you one thing. Okay. So I don't know if you listen to the last part of my speech, but then I never claimed that it doesn't need active participation. What I am claiming is if the policies are totally not there, it is a structure, and a structure needs the support, yes. But without the structure, the millions of people who are saved. What I am fundamentally trying to claim is, even if there is a large part of population which is not being reached, which I already said is 20 to 25% of the population, yes, but what about the 70 to 78% of the population that have been saved by these government policies? I'm not going to let go of these government policies for a small amount of people who are afraid because of stigmas or unawareness. I am going to try harder to reach those people instead of stopping what is already working.
Yeah, sir.
So yeah, thank you, Sahana and Kushagra. Now we'll go to our last speaker of the day, Pandi Meenashri, to speak about public participation.
Am I audible, everyone?
Yeah, you're audible.
Okay. A very good evening to everyone. I'm Fandi Minastri. As I have already introduced myself, again, I'm Certain. I'm from Thuthukudi Medical College. I'm studying final year in MBBS. So here, my participants and my opposition team and as well as the proposition team have mentioned about all those things. Now I have a final rebuttal speech only. So tuberculosis is not just a disease; it is a warning a warning about silence, stigma, and social failure. And today, this debate is not about who has better policies. It is about what actually ends a disease, system, or people. Let me begin with a fact no one can ignore. India accounts for nearly 1/4 of the global TB case. So I ask, if policies alone are powerful enough, why are we still here? Policies don't guarantee outcomes. Yes, policies exist. Yes, programs exist. Yes, funding exists. But still, millions people suffer every year. This is not a gap in policy. That is a gap in people's participation. Because policies can provide treatment, but they cannot compliance. TB spreads in behavior, not in buildings. Tuberculosis does not spread in government office. It spreads inside the home because people hide symptoms, patient stops medication, family fears stigma. Now tell me, can any policy sit beside a patient every day? Can any law remove fear from a family? No. TB is a social disease and social problems need social solution and social action. Real success happens only when people act. Wherever TB has reduced, one thing is common: people has participated actively. Communities spread awareness, supported patients, took responsibility. And when people took ownership, disease lost control. Behavior decides everything. Medicine exists, treatment is available, yet TB continues. Why? Because people delay testing, ignoring symptoms, stop treatment halfway. Am I audible? Sorry, it is showing like I have lost my network connection. So please, someone tell me.
You're
I'm
audible.
audible.
Yeah, you're audible. You're audible. Your
Yeah,
video
fine.
isn't visible, but everything is fine.
Okay, fine. People delay testing, ignore symptoms, stop treatment halfway. So let's be honest, tuberculosis is not defeated by medicine alone. It is defeated by discipline. And discipline comes from people. Respected judges, my opponent spoke about policies. We are speaking about reality. They spoke about systems, fundings, infrastructure. But let me ask one question. Can a policy enter a household and enforce a behavior? No. They believe systems will solve the problem. They know that people decide the outcome. Because the truth is, patients stop treatment. Family hides TB. These are failures of participation. I have two real world proof, not two, more real world proof, but I want to say two real world proof. One is COVID-19 pandemic. Rules were everywhere. But control happened only when people followed them. Not government can monitor every citizen. Only people can control a pandemic. And another thing, we have already studied when we were in a school. We were gone to school. Chipko movement. In the 1970s, forests were being destroyed despite government control and their policies. Policies failed to stop it. So what did people do? They just they hugged the trees. They stood between destruction and survival. And because of that, forests were saved. Policies were forced to change. The forests were not saved by policies. Policies changed because people acted. And here I just wanna say one Tirukkural, and this truth is timeless. குடிச்செய்வார்க்கில்லை பருவம் மடி செய்து மானம் கருது This means when it comes to protecting society, people must act without delay. And in tuberculosis, delay spreads the disease, hesitation strengthens it, silence protects it. Final closing, I just want to say, so let us stop pretending policies are important, but they are not enough. because policies can build hospitals, they can provide medicines, they create systems, but they cannot change the mindset of people. They cannot remove the stigma. They cannot ensure the responsibility. Only people can. Government policies can start the fight, but only public participation can finish documents. It ends in decisions. Those decisions are made by people. I think everyone got my point. Thank you.
Thank you so much, Pandimina. Is there any cross questions for her?
I'm really sorry for my poor network connection. I'm just trying to connect it properly. Really sorry for this inconvenience.
Actually, if you turn off your video, I guess your audio will be very clear.
Yeah, I will turn it off. I will turn it off. Yeah.
Yeah.
Now am I audible
Sure.
enough?
Yeah, you're audible.
Okay.
Is there any cross questions from the government policies team? I guess Shai Shakti turned on her mic. One at a time, please. One at a time, please. I could understand you people are very enthusiastic to ask the cross questions. And Sai Shakti asked first, so over to you, Sai Shakti.
Thank you, sir. So the question is going to be very simple. So again and again, you had stated that it is you cannot enter into a home and enforce a behavioral change. You cannot bring a change in the discipline and all that. But let me tell you, as a doctor and with the help of government policies and with my healthcare system in my hand, I can give my patient the treatment he or she needs and send her home, advising her about how she has to take all those medications. But I cannot send her home relying on the fact that her family members is going to advise her about what treatment she's going to buy from counters or what she has to do. Instead, as a doctor and with the government policies, I can put her on dots and make sure that I have the situation in control in my hand with the power that I have. So I cannot enforce a behavioral change, but as a medical professional, I can ensure that I'm treating the patient in order to, stop its spread. So I don't think I'll be agreeing with the statement that, we are going to fail in controlling a disease because I cannot enforce a behavioral change, because I cannot just use behavior as an excuse to let a disease spreading on its own.
Am I audible?
Yeah, you're
Yes,
audible.
you're audible.
Actually, from my side, what I have put it forth is um, government policies alone cannot cure a disease. They obviously need public participation, and only with that help we can cure any kind of disease. We have crossed over like thousands of diseases. Even Ebola actually came to a cure when the people started to participate actively. So that's the one and only thing I'm just putting it forth in front of you people, because one person, I forgot the name of that person, have mentioned structure without a structure. Government policy is like a structure. We thought that you can't people like go and take a treatment and all. Without function, what is the use of the structure? What is the use of a structure without function? So that function relies on the people, their participation. So that's I wanted to say. The government policies reaching the urban side, the urban areas, the urban people. But when it comes to the rural and villages, they are not. Those people didn't receive any proper policy things, medication and everything. So I'm just here to tell you that government policies doesn't cure the disease 100. At the same time, I'm saying public participation 100% alone cannot cure a disease. It needs the government policies, but without public participation, government policies are obviously useless. That's what I wanted to say. Do you have any other further question, or am I not clear?
No, Mani, actually, no, this is clear. Actually, the last statement that you made was very strong and clear when you said government policies and public participation go hand in hand equally, because without government policies, of course, public participation would fail. And one thing that I'm trying to put, because since I'm in the side of government policies, just one thing that I'd like to place, because government policies above hand, is that when you know what's the right thing to do, the choice is yours to do the right thing or not. But first, you need to know what's the right thing to do. And that's exactly what government policies provide you with. That's exactly what I'm trying to say. Of course, public participation is required, but to know how the public should participate in the right way is given by a government policy. And without that, doing the wrong things and not going to move in the right way without policies is going to make it as a really messy situation. That's all that I'm trying to tell you.
Oh,
I
thank you so much,
completely agree with
Shakti.
your point. At the same time, I'm saying public participation is not a secondary thing. It is the primary thing. Each one of your like preposition people have said they just put forth government policies as the primary thing and public participation is a secondary thing. That is not. Both are the primary thing, especially public participation. So I just wanted to say some of you people have mentioned government policies and all, but public participation is a primary thing. I do not want that to be a secondary thing when it comes to curing the disease and when it comes to a pandemic or endemic thing.
Absolutely. I agree with that. And all that I'm trying to tell you is when we agree to the fact that it all goes hand in hand, it's already a win. It's already a win situation either sides. Thank you.
Yeah.
Yeah. Okay. Yeah. Over to Karnika, I guess. She's trying to speak. Karnika, you have any questions? Cross questions?
Yeah. So you had mentioned that if policies don't guarantee outcomes, So do you believe outcomes can be achieved without any policy at all?
At all time, there are some situations where without government policies, people took that thing in their hands and they won. So I could say with pure 100% public participation, yeah.
Like, I'm sorry for interrupting. You had also mentioned about Chipko movement. So
Chipko movement, yeah.
there is a difference in the scale, right? Chipko movement was a small community. It happened in a very small community. It was just barely a village. How can you expect something of that sort in a process which is not just affecting a country, but it is rather affecting the entire world? And another thing that you mentioned was discipline comes from people. What do you think is going to ensure that millions of people are going to remain consistently disciplined without any structure or enforcement? So as far as I know, if there is, again, you had mentioned that what is the use of a structure without functionality? It is, according to me, it is important. Both of it works hand in hand. And the points that I just kept, I guess if government policy does have an upper hand.
Can I start to speak or?
Yeah. You can start.
You have mentioned the Chipko movement. It is a small movement. Okay, fine. That are all fine. Why I mentioned this example here? It is because you people have said public government policies are main to solve one thing, like without public participation or public participation being secondary thing. I just gave this example without government policies or when the government starts to fail with their policies, people and the public, that specific community took that thing in their hands and they own it. So public has that power. That I just wanted to say. Whether it is a small like community thing or whether it is a large like a world endemic or like pandemic thing or whatever, if public think it in their mind and if they are taking it on their own hands, then only all those things will get to solve. I agree with your point. You have said without government policies, no one can hold that discipline. Like each and every people can't hold that discipline. But what I am here trying to say is that discipline, that listening to the government people and everything, it's still in people's hand. If government policies has won, either with the public participation, like a neither or nor, it's a neither nor situation. With or without public participation, they should cure the disease, right? Like it is the debate. But I wanted to say only when the public is taking the thing in their hands, it will get solved.
So are you trying to say
Karnika,
that
you asked this question, right?
Yeah. I was the one who asked it.
Okay.
So are you trying to say that if, like, because a couple of the policies that you claim to be have failed, because of that, if a lot of people join hands together and they all go onto the streets and they spread, I don't know, information, do you think tuberculosis is going to be solved overnight without any of the other things? And because government policy is not just, propaganda, but it is also the various other things, like the vaccines that you take, the medicines that you get, everything is going to come under government policies. So if you're going to be like, no, people, put in your minds, let us all go hit the streets, let us all take this onto our hands. If you're going to say that, do you think people are going to, what is the criteria, what is the rate that you're going to say that, can you give me another example of a disease of this large of a scale which has reduced because the government policies has failed and solely because of the voluntary participation of the people?
It actually happened in Kerala, that Nipah virus outbreak. Actually, people took everything in their hands, and I can't say government failed there. In Kerala, those people, like government and those public, those two people actually joined their hand to solve this disease, and they cured it. But when it comes to TV, we people are like holding that stigma thing, and we are not accepting the government policies. So it's up to the people participation. And one question you have asked, I have nice answer for you. Because meaningful public participation often starts at a grassroots level and then creates a wider impact. In fact, many large-scale public health successes begin with small community engagement, which then influence policy, awareness, and behavior at a larger level. So, the size of the participation does not reduce its importance. It highlights how powerful even a small committed group can be in driving change. When, like you have asked about the Chipko movement, right? So,
okay, but what about the other point that I mentioned?
Other
Government
thing, yeah, I have already
policy.
said Nipah virus. Nipah, I just mentioned about like not in disease curing thing, but there is one thing whole world entirely knew it. When government fails to do that, students took that power. Jallikattu, everyone knew that thing. So here I'm just saying that when you are saying like government policies fail to do that, like public participation means a lot. So I just wanted to say that thing. But when it comes to disease, obviously like government policies are important, but without public participation, it is nothing. That's I just wanted to say.
Okay, so I just have just
people,
one last.
Okay. One last question.
Yeah, one last, not exactly a question, more like a statement. Like you mentioned that you mentioned Jallikattu and you were like the government failed and it was the students who took it up on their arms and they approved it. Yes, but if we are going to try doing that for tuberculosis, which is a disease, it is not going to happen.
I clearly
We
said
can't do that. And I'm not
I just put forth that example. It is not. I'm not talking about the disease. When the government policies fail, then people like public, like you have asked one question. Does it public participation enough to make one thing happen? Yeah, it happened. Okay, but when it comes to disease, I didn't say that thing. I just want to be clear again. I didn't say that thing for disease. But I just wanted to say that because Chipko movement, it's like a movement only. Chipko movement is also not a disease. Public took that thing in their hands and then they solve it. Likewise, I said.
And the thing is, what I asked very specifically was whether a disease has happened in such a large scale.
Okay, people, I have to conclude this. I really have to conclude this debate actually. Why? Because it's like a never-ending story for both of you actually. From my side, I really want to call upon our judge actually. Why? Because he has a very good overview of this, and you people already has concluded like without public participation, these government policies couldn't be like implemented, as well as without the public's cooperation, these government policies could not be created as well. So depend upon their each one of the perspectives, these primary and secondary goals will be different. So that's all from the moderator side I want to say, but the ultimate is our judge. So over to you, sir. We're really like waiting for your comments so far, sir.
Then, sir.
Sorry, sir, you please start, sir. I'm listening. Let me recollect my thoughts.
Okay.
I'm flabbergasted.
So, thank you, Arunagiri. Thank you, Kannan, sir, for this opportunity. I think See, it was wonderful to hear young people talk on TB, and it's, I mean, one of those diseases that has been so prevalent, and most of us see at least one or two patients almost a day, every day, or every second day. And um, and I know a lot of you are using AI to get all these debates in, and there were points that were slightly offline. But then that's what the generation is all about. So we come from a generation where we had tuberculosis control program, then it became tuberculosis elimination, and now it is all talk about ending TB. So I think the government has evolved tuberculosis treatment and the policies over so many years, and it's getting better. The diagnostics which were there only in the private side is now also available. So the treatment, the standards of care, all these things are also coming to the government sector. This on one side. But then we live in India where there are certain bad words that you can't use, like ventilator, dialysis, and TB is one of those. So if you tell someone you have TB, எங்க குடும்பத்துல எல்லாம் யாருக்கும் வராது அப்படின்ற ஒரு thought process is there. So we still see young people who have had lots of damage to their lung because of TB. So that we live in a world where people don't accept science as science. So we live in these two. So I mean, to me, I think it is about both. We have a wonderful program that gets updated, that gets more current, more scientific on one side, and we have a population that is also trying to learn itself. So இது வந்து ஒரு கல்யாண வீட்டுல வந்து ஒரு மண்டபம் எடுத்தாச்சு, மண்டபத்துல வந்து எல்லா டெக்கரேஷன் எல்லாம் பண்ணியாச்சு, சாப்பாடெல்லாம் நல்லா சமைச்சாச்சு. ஆனா 10 பேர் தான் வந்து சாப்பிட்டாங்கன்னா எப்படி இருக்கும்? நல்லா இருக்காதுல்ல. எல்லாரும் நிறைய பேர் வந்து சாப்பிட்டா it will be better. So I strongly think the government policies are getting better. They are doing very good job on TB. And public participation is something that is essential to push it forward, and both should go hand in hand. Over to you, Kannan sir, for your comments.
Into so much of trouble. Anyway, so I was flabbergasted by listening to this. Am I audible, Arnigri?
Yes, sir. You're so audible, sir.
Okay, sorry, in a cubicle, in corridor in the hospital still, where the signals are very bad. Anyway, good evening to everyone. I just wanted to ask one question. Just wanted to know how many of you were prepared more for this debate than your internal exams, yeah? Than your IAs or your formative exams?
Sir, me, sir.
Why? Are you having exams tomorrow?
No, sir. Very nervous about speeches, sir.
Okay. Right. It's a very safe space here. There's no faculty here, and there's nobody who's going to evaluate your attendance. But one thing I should say, Hari sir, I'm very much confused. Am I sitting and listening to a medical debate, or is it the election fever or an election campaign that I'm listening to?
Oh, okay.
I'm just wondering whether MSN is becoming an election. Anyway, cut across this.
We are that much.
I think
that much capable to do the debates.
But
we just took that much speakers to present over here, sir.
I know. I have. It's just that we need to keep all these speakers' names and their mobile numbers and their email IDs in our in our Google sheet. So anytime we need, I think we should keep them in the forefront, not only in the social media. We should also bring them out, all these speakers. But though they are from far and wide, wherever they are, they've spoken with a lot of confidence. They've spoken with a lot of clarity. There was a lot of expressions. But I'm telling you guys, if medicine is difficult for you, you always have a backup option: public speaking. So you can always go ahead, guys. I'm with you. Right. Coming to today's thing, TV, government versus public. Like you can always say government policies are the backbone, but you can always say public participation is the key. But think like this: who's the person who makes the plan, and who's the person who actually does the work? We all know that. If one person does and the other does not do anything, then the entire project fails. The designs, the best programs can be made by the governments. They can get the best schemes. We can have great posters. But then when you come to the OPD, we always have patients saying, "Doctor, I stopped the medicines because I felt okay." So what will happen? The policies will go to and will stay back, will not see the light of the day. Similarly, public participation, motivated, enthusiastic, everything. But then without a proper system, without a proper drugs, without proper diagnosis, it's like passing our exams without confidence. See, it is very, very important for public participation, motivation. So similarly, the medications, those drugs, whatever we say, that is also important. If you ask me, government alone, it is not enough. Public alone is not enough. But my humble suggestion, or my humble, I would not say, I would always say that both together, since 1 hour, both together spoke, and we enjoyed the energy which of it. Some of you spoke like clinicians. Am I audible? Am I missed?
Yes, sir.
Hello?
Yes, sir. You're audible, sir.
Okay.
You're audible.
Right.
You're audible, sir.
Okay, I'm sorry.
Yes, sir.
Some of you spoke like clinicians here. Some of you were like those public future WHO experts. Yeah, and I'm sure most of you should be in the prime time debates. And the one thing is that the organizers had this lots of rules. Otherwise, we should have asked both the teams to say, "I agree, I disagree, I everything." Then it would have been great. But then, having said that, it is not about diagnosing. It is not about prescribing. It is about everyone. I'm sure you will all understand. We all know that how do we have to do for convincing the patient, and how do we make the society to understand that, and how to work within the system. So these are the things which you have actually told us, which is not written in the textbook. And I'm very happy that this is being recorded. So with a bit of an editing, I think this is how it has to be played across, I suppose. It is not about government versus public. I would always say government plus public and we. We. At the end of the day, we are the ones who are explaining the policy, we are motivating the patient, and we make sure that the treatment actually works. This is what Hari sir will also be doing in his OPD, and this is what I will also have to do. I'm from the surgical disciplines for me to convince. But I'm sure some of you would become excellent doctors. Some of you would become good public health, WHO, etc. But I'm very sure that all of you would be policymakers. So it is a mission that has to complete, and all of you are always a part of the team. And please do remember, guys, when you become famous, when you become policymakers, we were also the first judges or moderators who had recognized you. And thank you, guys. Thanks for everything. Thanks for calling us. And it was absolutely fantabulous. It was an amazing evening, which I love. And this is more of a team talking. This is not even debate. And I am sure MSN should have these kind of things. And we will do our level best to bring in more audience. Thank you, guys. Thanks a lot for inviting me.
Thank you so much, sir. Thank you so much for
Sorry,
taking your
I
time.
could not
And,
get my... No. Sorry, I could not listen. Right. Thank you so much.
thank you so
Thank
much,
you,
sir.
sir.
Thank you so
Thank you,
much, sir.
sir.
Thank you very much.
Thank you, Arunagiri.
Thank you so much, sir.
And all the speakers, amazing. Can we have all the speakers? Hari sir, you should also open your video, sir, so that you can take a somebody can take a nice picture and then you can share it.
Akash,
Yeah.
are you there?
Yeah.
Those
Yes,
using,
I'll do it.
Smiling
I'll
picture.
do it.
yeah, those who are using laptop, you take the screenshots.
Yeah, I know. People are grooming themselves properly for the photograph. All of us smile. Hari sir, give your $1 million smile, Hari. Amazing. Thanks, team, for doing this. And that's the whole idea of being with people around.
Offline debate for sure, sir, without having any fight for sure in the real.
No, this is not a
Thank you
fight.
so
This is not. This is not at all a fight. This is just that a lot of people whom we know, and we have noted down a couple of names who are very good.
Yes, sir.
And
Yes, sir.
And I'm sure
We'll definitely.
my humble request, I will try my level best to travel. I'm in one at this point of time, till at least 3 or 4 days. I'm there in some institutions. So I'm going to meet as many people as possible, and please do make sure that your friends become members of MSN. I'm sure there are multiple organizations. You can be a member of multiple organizations also. Great. But at the end of the day, all of us are the ones. I'm not talking politics, but then at the end of the day, you are the ones who are going to make this Vikshit Bharat. I leave it at that level, whichever you are in. Thank you, guys. Thank you.
Thank you so much, sir. Thank you so
Bye.
much for the teams who have participation, for your lovely debate and sharing your ideas. And thank you so much for the government policy team as well as the public participation. So thank you so much, guys, for a serious, fantabulous debate. And over to Sanjana for the vote of thanks.
Thank you, sir. So, as we come to the conclusion of this insightful and engaging debate, I'd like to take a moment to express my heartfelt gratitude to everyone who contributed to making this event a success. So, first and foremost, I'd like to extend my sincere thanks to our esteemed judges, Dr. Hariharan sir and Dr. Kannan sir, for graciously accepting our invitation and for dedicating their valuable time to this event. Your thoughtful evaluation and constructive insights and expert guidance have truly added depth and credibility to today's discussion. I would also like to express my deep appreciation to our patrons, state team, and our state coordinators for providing us with this wonderful opportunity and for their constant support and encouragement. My heartfelt appreciation goes out to all our participants. Well articulated arguments, your confidence, your enthusiasm made this debate intellectually stimulating and truly meaningful. Each one of you brought out unique perspectives that enriched the discussion on such an important public health issue. I would like to sincerely thank Dr. Arunagiri sir, Nitish Stephen, Nirmal, and Akash J for their dedicated efforts in planning and success. A special note of thanks to Avinash and Jargav from technical team for ensuring the smooth and seamless conduction of this session. I would like to extend my gratitude to our wonderful audience for your time, attention, and active participation. Your presence and engagement truly added value to platforms like these. On this occasion of National Tuberculosis Day, let us carry forward the spirit of today's awareness, reduce stigma, and work collectively to of tuberculosis. Thank you all once again. Wishing you a wonderful evening. I like to extend my gratitude to our audience as well. Thank you.
So, guys, finally, I would like to lend a minute from you guys. Thank you for accepting my invite and speaking on the debate. It was truly mesmerizing, your talks and your fight. Like, I can't say it a fight, it was a debate. It was truly good, and everyone proved their potential in it. And I would like to thank Arunagiri sir and Akash and my team, Sanjana, Kavya, and tech team, Jargav and Avinash, for making this event truly successful. Thank you, guys.
Thank you for having us all inside, Nitish. It was a great evening and a great debate, guys. It was very interesting to see you all. Thank you.
Thank you so much,
thank
guys.
You, sir, for this,
thank you so much.
In organizing this amazing event.
Really amazed the people. Really amazed. Thank you so much. Akash, you can end the session.
Okay, sir. Thank you.
Once again, bye.